Welcome to today's video about 9 warning signs of blocked arteries in your neck. Your vision suddenly goes dark in one eye. A few minutes later, it returns. You shake it off as tiredness. 3 days later, you wake up unable to move half your body. This is how strokes happen, not with fanfare, not with obvious pain, with quiet warnings that most people dismiss as nothing. Right now, arteries in your neck might be slowly closing. Your brain is getting less oxygen every day, and your body is sending you signals that something is terribly wrong. These signals don't last long. They disappear. That's why people ignore them. But here's what doctors know. These temporary symptoms are your last chance to prevent permanent damage. I'm going to show you exactly what to watch for and why the 5th warning sign is the one that sends people to the emergency room when it's already too late. Before we start, I want to ask you something. If this information helps you or someone in your family, hit that like button right now and drop a comment telling me where you're watching from. I read every single one. Your support helps this life-saving information reach more people who need it. So let's get started. Your carotid arteries are 2 major blood vessels running up both sides of your neck. They carry oxygen-rich blood directly to your brain, face, and head. When these arteries get clogged with plaque, a mix of cholesterol, calcium, and fatty deposits, your brain starts starving for oxygen. That's when the warnings begin. According to the CDC, carotid artery disease is responsible for about 8% of all ischemic strokes in the United States. But here's the alarming part. Studies published in the Lancet Global Health show that up to 60% of people with significant blockage have absolutely no symptoms until they suffer a stroke. That means 4 out of 10 people do get warnings, small signals, brief episodes. And if you know what to look for, you can stop a stroke before it happens. All right, let's go through the key warning signs that your neck arteries may be blocked, starting with the first one. Mini strokes that disappear, the final warning. Doctors call this a TIA, a transient ischemic attack. Your body calls it a practice run for a real stroke. This happens when the blood clot temporarily blocks blood flow to your brain. You might lose vision in one eye. Your arm suddenly goes numb. You can't speak clearly. Then, within minutes or hours, everything goes back to normal. So you think, I'm just stressed or I need more sleep. But the American Stroke Association reports something terrifying. Nearly 1 in 5 people who experience a TIA will have a full stroke within 90 days. And research published in Stroke Journal shows that almost half of those strokes happen within the first 48 hours. Read that again. If you have a TIA today and do nothing, you have up to a 50% chance of having a major stroke within 2 days. Your brain just showed you what a stroke feels like. It gave you a warning. Don't ignore it. Next, warning sign number 2, one-sided weakness or numbness. Your brain controls the opposite side of your body. So if your left carotid artery is blocked, you'll feel weakness on the right side. This isn't regular tiredness. Your right arm feels heavy, like it's filled with sand. Your right leg drags when you walk. The right side of your face might feel numb or strange. Johns Hopkins Medicine identifies this one-sided weakness as one of the earliest red flags of carotid artery blockage. These episodes might last a few minutes. They might last hours, but they're not random muscle fatigue. They're your body screaming that half of your brain isn't getting enough oxygen. If you've noticed this even once, even if it went away completely, you need to see a doctor immediately. This is an emergency warning signal. Next, warning sign number 3, speech problems you can't explain. You're talking to your family when suddenly the words won't come out right. You're slurring like you've been drinking, but you haven't touched alcohol. Or someone speaks to you and you can't understand them. It sounds like gibberish, even though you know it's English. This is called aphasia. It happens when the language centers in your brain are deprived of oxygen. Studies show that about 25% of people with carotid artery disease experience speech difficulties before they have a major stroke. Here's what's happening. Plaque is blocking your carotid artery. The part of your brain responsible for language is suffocating. Your brain tries to work around it, but it can't keep up. These episodes might be brief, but they're not flukes. They're warnings that your brain is running out of time. Next, warning sign number 4, sudden vision loss in one eye. You're reading or watching TV when suddenly it's like someone pulled a curtain down over one eye. You lose vision partially or completely. It might last seconds, it might last several minutes, then it comes back. Doctors call this amaurosis fugax, temporary blindness caused by lack of blood flow to your eye. Harvard Medical School explains this happens when a small piece of plaque breaks off from your carotid artery and temporarily blocks the artery supplying blood to your retina. Think about that for a second. If plaque is breaking off and traveling to your eye, it can also break off and travel to your brain. When that happens, you don't get a temporary problem, you get a stroke. If you've experienced sudden vision loss in one eye, even if it came back completely, you need emergency medical attention today, not next week. Next, warning sign number 5, severe headaches that feel different. This is the warning sign most people completely miss. When your brain doesn't get enough oxygen, it triggers a pain response. That's why people with carotid artery blockage often experience sudden, severe headaches that feel nothing like their normal headaches. They're sharper, they come on faster. Regular painkillers don't touch them. Research shows that up to 15% of people with carotid blockage report unusual headaches in the weeks or months before a stroke. Not every headache means blocked arteries, but if you're over 50 and you're suddenly getting headaches that feel completely different, especially if they're on one side of your head, and you have other risk factors like high blood pressure or high cholesterol, your body is waving a massive red flag. Don't brush this off as stress or caffeine withdrawal. Get it checked. Next, warning sign number 6, dizziness and balance problems. Your brain coordinates every movement you make. But when part of your brain is being deprived of oxygen, your coordination breaks down. You feel dizzy for no reason. The room spins. You lose your balance while walking and have to grab onto furniture. Or you fall for no apparent cause. The Cleveland Clinic reports that balance problems and unexplained dizziness are common in people with severe carotid artery disease. Here's what's happening. The parts of your brain that control balance and spatial awareness aren't getting enough blood. Your brain can't process where your body is in space. That's why you feel off balance or dizzy. If you've been having dizzy spells or unexplained falls, don't just assume you're getting older. This could be a sign that your carotid arteries are dangerously narrow. Next, warning sign number 7, a whooshing sound in your neck. When blood flows through a narrowed artery, it creates turbulence. That turbulence makes a whooshing sound called a bruit. Sometimes, if the blockage is severe enough, you can hear the sound in your own ear, especially when lying down in a quiet room. It sounds like a rhythmic whooshing that matches your heartbeat. More often, your doctor will hear it with a stethoscope placed on your neck. The American College of Cardiology recommends that doctors check for carotid bruits in anyone over 65 or anyone with cardiovascular risk factors. If your doctor tells you they hear a bruit in your neck, take it seriously. It means blood is struggling to get through your arteries. Next, warning sign number 8, memory problems that come on suddenly. Your brain uses 20% of your body's oxygen supply, despite making up only 2% of your body weight. So when your carotid arteries are blocked, one of the first things to suffer is your memory and thinking. You start forgetting things you normally remember easily. You feel confused for no reason. You have trouble concentrating or making simple decisions. Research published in Neurology found that people with significant carotid blockage perform worse on memory and thinking tests compared to people with healthy arteries. Here's the key difference. If your memory problems come on suddenly, or they're getting worse quickly, or they're happening alongside other warning signs we've discussed, that's not normal aging. That's your brain crying out for oxygen. Next, warning sign number 9, facial drooping on one side. When your carotid artery is blocked, the muscles on one side of your face might stop receiving proper signals. One side of your face droops. Your smile looks uneven. One eyelid hangs lower than the other. The American Stroke Association teaches people to remember FAST: face drooping, arm weakness, speech difficulty, time to call 911. If you notice any of these signs in yourself or someone else, even if they go away, you need emergency medical help immediately. Don't wait to see if it gets better. Don't drive yourself to the hospital. Call 911. Every minute counts. Every minute without oxygen kills brain cells permanently. Next, what to do. If you're experiencing sudden symptoms like vision loss, weakness, or speech problems right now, stop everything and call 911. Do not drive yourself to the hospital. Do not wait. If you've had mild symptoms that come and go, like dizziness, headaches, or memory issues, schedule an appointment with your doctor this week. Tell them you're concerned about carotid artery disease. Your doctor can perform simple, painless tests. A carotid ultrasound uses sound waves to look at blood flow in your neck. A CT or MRI scan shows any blockages. A physical exam where they listen for bruits in your neck. If they find the blockage, there are proven treatments available. Medications to prevent blood clots and manage cholesterol, lifestyle changes including diet and exercise, in severe cases, surgery to remove the plaque or insert a stent. The National Institute of Neurological Disorders and Stroke reports that treating carotid artery disease before a stroke occurs can reduce your stroke risk by up to 50% for severe blockages. Catching it early is the difference between preventing a stroke and recovering from one. Next, how to protect your arteries starting today. Control your blood pressure. High blood pressure is the #1 risk factor for carotid disease. The American Heart Association recommends keeping your blood pressure below 120/80. Work with your doctor if yours is higher. Manage your cholesterol. LDL cholesterol builds up in your arteries. Studies show that lowering LDL can slow or even reverse plaque buildup. Eat more fiber, healthy fats, and less saturated fat. Stop smoking. Smoking damages your artery walls and accelerates plaque formation. Research published in Stroke Journal shows the risk decreases after 2 to 4 years of quitting and returns to non-smoker levels by 5 years. Exercise regularly. Even 30 minutes of walking daily improves blood flow. A meta-analysis published in Stroke found that highly active individuals have a 25% lower risk of stroke compared to inactive people. Eat an anti-inflammatory diet. Focus on leafy greens, fatty fish, berries, nuts, olive oil, and whole grains. Minimize processed foods, sugar, and excess salt. Manage diabetes. High blood sugar damages blood vessels. If you have diabetes or prediabetes, keeping your blood sugar controlled protects your arteries. Get regular checkups. If you're over 60 or have risk factors, ask your doctor about carotid artery screening. I know this information might feel overwhelming, but knowledge gives you power. The fact that you watched this video means you're taking your health seriously. Most strokes are preventable. The warning signs we talked about today aren't a death sentence. They're your opportunity to catch a problem before it becomes a crisis. If you recognize even one of these warning signs in yourself or someone you love, please don't wait. Make that doctor's appointment. Have that conversation. Get checked. Your brain is worth it. Your life is worth it. If this video helped you understand something important, type yes in the comments right now. Share this with anyone over 50, anyone with high blood pressure, or anyone with diabetes. You might just save their life. Subscribe for more evidence-based health information that can make a real difference. Your body is always talking to you. Learn how to listen. Stay healthy, and I'll see you in the next video.